Welcome to CSIS Online. The way we bring you events is changing, but we'll still present live analysis and award-winning digital media from our Dracopolis Ideas Lab. All on your time, live or on demand. This is CSIS Online.
Hello, I'm Dan Rundy. I'm a Senior Vice President here at CSIS, and I hold the Schreier Chair in Global Analysis. I also direct the Americas program here at CSIS. The road to the 2022 Summit of the Americas, vaccine diplomacy and engagement, is what brings us together today. The COVID-19 pandemic is arguably the most significant economic and social disruption since World War II. In addition to being the moral and right thing to do from a public health standpoint, whichever country is seen as solving the COVID-19 vaccine challenge will reap enormous public diplomacy benefits. Latin America and the Caribbean has been the most devastated region by the pandemic in terms of fatality rates and negative economic impacts, and represents 31% of fatalities globally. In addition, COVID-19 has impacted politics, drastically set back education, and put pressure on democratic governance in the region. This event seeks to discuss what efforts the U.S., as well as partners in the region, multilateral institutions, and others might take to address the vaccine challenges and prepare for future pandemics in the Western Hemisphere. I want to thank all of our viewers today for joining us to discuss this issue of vaccine diplomacy and health engagement in the Western Hemisphere. I'm also really pleased to welcome our distinguished panel for today's discussion. First, I want to recognize my colleague, Catherine Bliss, who's a senior fellow and director of the Immunizations and Health Systems Resilience at the Global Health Policy Center at CSIS. Catherine also has extensive experience in the Western Hemisphere and was formerly the deputy director and senior fellow within both the Americas program before moving to the Global Health Policy Center at CSIS. Thank you, Catherine. Elizabeth Fox, the Chief Technical Leadership Officer for the Pan American Development Foundation. I think the best social enterprise in the Western Hemisphere is the Pan American Development Foundation. So grateful to have Dr. Elizabeth Fox. She's a senior leader in global health with 40 years of experience in making communications, behavior, and culture central to health programs around the world, including work at USAID. My very good friend, Ambassador Alfonso Jose Quiñones Lemus, who is the Guatemalan Ambassador of the United States. Thank you, Ambassador Quiñones, for being here today. I'm very grateful. My new friend, Maria Luisa Boyce, who's a Vice President of UPS Global Public Affairs. Maria brings over 20 years of experience in leadership in international trade, customs issues, and cross-border trade. In her current role, she advocates for UPS's priorities on Capitol Hill, supports the company's government affairs efforts in Latin America, and brings an active private sector perspective to this conversation, which I think is central. There's the central role for the private sector in this discussion. So I was really anxious to have a private sector voice like UPS. So thank you, Maria. Then we have my friend, Dr. Bill Steiger, who's the former chief of staff at USAID. Dr. Steiger was was director of the Office of Global Health Affairs at the U.S. Department of Health and Human Services at HHS, and a special assistant for international affairs to the Secretary of HHS. During this time, he served as a member of the executive board of the World Health Organization, the executive committee of the Pan American Health Organization, and has served on the board of directors of the Global Fund to Fight AIDS, Tuberculosis, and Malaria. So thank you, Bill, for being here. Thanks again for everyone for joining us today. I'd like to begin this discussion with a couple of overarching questions. Where are we in the crisis today in the Western Hemisphere, the COVID crisis today in the Western Hemisphere? What can be done in the Western Hemisphere to respond to this crisis over the next 12 to 18 months? What must be done over the next 12 to 18 months? And what specific action steps can we collectively take at the Summit of the Americas, which will happen in June, in 6 months' time, in June of 2022, here in the United States, to address the current challenges of COVID-19, as well as to generate greater resilience for, unfortunately, the future pandemics that might come our way. So, Catherine, let me first turn to you and give you a chance to respond to those meta questions or anything else you'd like to say. So, Catherine, over to you.
Great. Well, thank you very much for organizing this and for inviting me to participate. As of today, we're 2 years into a global pandemic. There have been about 271 million confirmed COVID-19 cases worldwide, more than 5.3 million deaths from COVID-19, and 8.5 billion vaccine doses administered. And we know the first case in Latin America and the Caribbean was reported in Brazil in February of 2020, when a man who had traveled from Italy during a surge of infections there became infected and then returned home to Brazil. Since then, the region has been very hard hit by successive waves of COVID-19 transmission, most recently driven by the Delta variant. And then, of course, in the last 2 weeks, the Omicron variant has already been reported in Argentina, Brazil, Chile, and Mexico. To date, as you've said, there have been at least 1.5 million deaths from COVID in the region, almost 1/3 of the global total, and this for a region that's just about 8% of the world's population. And Brazil, Mexico, Peru, and Uruguay have all been unfortunately distinguished at one point or another with having the highest death rate from COVID in the world. But we know that in the region, a vast majority of deaths have been in just 5 countries: Brazil, Mexico, Colombia, Argentina, and Peru. Now, in December of 2020, a year ago, basically, countries began rolling out COVID-19 vaccines really around the same time that they were authorized for emergency use here in the United States. As of today, about 55% of the population in the region is fully vaccinated. And while that sounds good, it's highly unequal. Nearly 2/3 of the 35 countries have not yet covered 40% of their populations, while in others, immunization coverage is quite high. And the countries that have immunized over 60% of their populations include Argentina, Brazil, Chile, Cuba, Ecuador, El Salvador, and Uruguay. But on the lower end of the coverage spectrum, we see Guatemala, Bolivia, Honduras, Nicaragua, and Haiti, with Haiti's coverage estimated to be less than 1%. By contrast, Chile and Uruguay have administered boosters already to more than 40% of their populations. And in fact, Chile, I think, is the country in the world with the highest percentage of booster people. So, one of the issues that, you can ask is, what really explains these divergent experiences? And, one thing really is to look at vaccine supply. Some countries on the high side of coverage sought deals very early with a diverse group of manufacturers, well before vaccines were even approved. So they had a lot of options. And the manufacturers supplying countries in the region, include AstraZeneca, Johnson & Johnson, Pfizer-BioNTech, Moderna, Gamaleya producing the Sputnik vaccine, Novavax, and then of course, CanSino, Sinopharm, and Sinovac. And almost all of the countries in the region joined COVAX, the vaccine sharing mechanism led by Gavi, the Vaccine Alliance, the World Health Organization, CEPI, the Coalition for Epidemic Preparedness and Innovations, and UNICEF. And some of the lower and lower middle income countries, of course, joined the advanced market commitment that provided the vaccines at very low cost or free of charge. And that includes Haiti, Bolivia, El Salvador, Honduras, and Nicaragua. But most others joined as self-financing, meaning that they committed to put up funds in advance. And COVAX initially committed to provide 280 million or so doses for the region by the end of 2021. But we know that in September that that forecast had to be downgraded by about 25%, in part because of some of the supply constraints coming out of the export controls imposed by India during the Delta surge there last year. Now, the United States has donated about 45.6 million doses to the region, and other donors have made commitments as well. Canada has donated vaccine doses both through COVAX and directly in bilateral donations. Mexico has donated a number of AstraZeneca doses to other countries in the region, and the Dominican Republic is also sharing doses with countries, including Haiti, Honduras, and Guatemala. But I would just say, 2 additional things. Supply, even if the supply challenge, it sounds like it may be easy, delivering vaccines is a challenge. Even before the pandemic, we had already seen a decline in regional coverage of the 3 doses of the diphtheria, tetanus, and pertussis vaccine, usually given in a child's first year of life. And that had gone from about 93% in 2012 to 80% in 2019, with Brazil, Haiti, and Mexico really reporting significant drops during that period. And high population middle income countries like Mexico and Brazil were on the 2021 list of the top 10 countries with 0 vaccinated, with children who had received 0 doses, meaning that those children hadn't received any of the 3 doses of DTP. And then if we add to that some of the cold chain issues around storing vaccines, storing the mRNA vaccines, which we know require, even colder storage, and the need to train up additional health workers in a region that already had a shortage of trained health personnel, you have a recipe for difficulties. And then finally, I'd add here that even if it becomes, easier to get vaccines distributed and even out to the most remote populations and clinics where there's a trained, skilled health worker ready to deliver them, there's still the issue of vaccine confidence. And just like in the United States, in Europe, in sub-Saharan Africa, we're seeing quite a bit of vaccine hesitancy in Latin America and the Caribbean, and it's driven by a number of factors. One is misinformation. They're on social media or word of mouth, the transmission of rumors that have been circulating about the vaccines. Another factor is, who the vaccine producer is. And we know that surveys show that people are skeptical of vaccines produced in one country or produced in another country. There's also, the issue of the messenger, who's delivering information about the vaccines. And then finally, in a region that's still struggling with vaccine confidence, we really need, as we think about how to bolster COVID-19 vaccine coverage toward the end of 2021 and into 2022 and beyond, we really are not going to be able to address all of this until we look at vaccine access, vaccine delivery, and vaccine demand all at the same time.
Thank you very much. Thanks, Catherine. Elizabeth, let me bring you into this. Elizabeth Fox, I'd welcome some opening thoughts from you, please.
Yeah, thank you, Dan, and thank you, CSIS, for organizing this event. I'm going to take this in a slightly different direction. The COVID crisis in Latin America and Caribbean has really three paradoxes, I think, that provide opportunities, both to counter China's vaccine diplomacy efforts and to better adapt to the next pandemic. The first paradox, I think, is that Latin America traditionally has had relatively strong public and private health systems and a proud history of success in vaccination campaigns, for example, with smallpox and polio. Yet, as Catherine says, COVID-19 hit Latin America harder than it hit poorer countries in Africa and Asia with weaker health systems and lower childhood vaccination rates. So the summit really is an opportunity to form partnerships, I think, with scientists and university and activists to explore this paradox and sort of understand both the virus better, but also what's going on with the primary health systems for the next pandemic. For example, is it the challenge of vaccinating many people on the move, displaced people, refugees, and migrants, which Latin America and Caribbean have a lot of, or is it something else? So the contrast between what's going on in Latin America and other Asia and Africa countries, I think, is something that really puzzles us. The second paradox is that, while as a whole, the people in Latin America, and we've seen this in surveys, have very low trust in their governments. But despite that, comparatively, the rates of vaccine hesitancy are relatively low. If you look at the figures around the region, that despite, I think, some of the anomalies I think that Catherine has pointed out, but I think acceptance is relatively high. And understanding vaccine hesitancy and its relationship with trust is really key to addressing the next public health emergency. And, as we've seen, Latin America is becoming a pretty vaccine sophisticated region. And if a vaccine doesn't work or is less kind of efficacious, people are talking about it and actively seeking alternatives. I think we can work with partners in the region to better understand what's going on in the relationship between vaccine hesitancy and trust, even under authoritarian regimes. We can learn how to create more health literate populations, even in closed or closing non-democratic societies. And we can apply behavioral insights to reduce vaccine hesitancy and strengthen community ownership. The third paradox, and we've seen this already, is that even with less vaccine supply, 7 or 8 countries in Latin America and the Caribbean have achieved higher vaccination rates than the US. When vaccines are available, even in a region with really high levels of corruption, inequity, and violence, somehow civil society has managed to mobilize around COVID vaccination. We just saw the article in the paper today about 100% vaccination rates in Sao Paulo. The summit, I think, can bring the region together to learn what's being successful in these delivery methods. Is it outreach? Is it messaging? Is it something else that's going on in terms of community organization and solidarity? I think the summits of the Americas is an opportunity to bring together public health officials, researchers, civil society organizations, community-led organizations, and local governments to really learn from these paradoxes. Because soon, I don't know when, but soon, when vaccine supply is no longer the issue, the ability to distribute vaccines widely will rest on this intersection of local primary health structures and civil society trust and acceptance. And this is the intersection where public diplomacy, community resilience, and the next pandemic will be built. We began to see this with Ebola, and I think we're seeing it very clearly with COVID. So by building these relationships on the ground in Latin America, we can show that vaccine diplomacy, and public health are not contradictions. And I think that's one of the challenges I really look forward to discussing with you all this afternoon.
Thanks, Elizabeth. Thank you very much. Ambassador Quiñones, thanks for being here. I'm a great admirer of your country. I'm an admirer of your president. I was dismayed that your country was not invited to the Summit of Democracies. I thought that was a mistake. I'm really pleased that you're able to come on today, Ambassador Quiñones, and I know you have an important contribution to make. So please, I'd welcome you. You're an important partner of the United States. Thanks for being here, Ambassador.
Thank you very much, Dan, for the invitation, and also to CSIS for convening this very timely discussion, and obviously on a topic that is so important for the future of our countries. There is no doubt that COVID has been one of the most significant disruptors in our lifetime. It is very clear that we are still yet to defeat it, and one of the ways that really would help us to achieve that is vaccination. COVID has presented us with many challenges. So obviously, health is one of them, which we should put at the forefront, but there are also the economic challenges. And on both fronts, the countries have really gotten a heavy toll. In the case of Guatemala, so far we have 622,000 approximately people that have contracted the virus since it started, and right now we have less than 1,000 active cases. And we have had about 16,000 people dead because of the COVID. And you know, in a country like Guatemala, it's a very low number. But it's also the result of the government policies that were put in place since the beginning of the pandemic in order to try to minimize the impact. And in terms of the economy, I have to say that we did very well. Guatemalan economy is extremely resilient, and it has been proven during the pandemic. We just had a negative growth of minus 1.5% of our GDP. Whereas other countries in the region had 3, 5, and some of them have even double digits loss in their GDP. And this year we are projected to growth around 6% and maybe higher. But you know, unfortunately, on the issue of vaccines, we did not do very well. And let me explain you why. In the early stages of vaccination, we were not able to have access to vaccines. We had the money. The Guatemalan Congress allocated the money to purchase the vaccines, but the companies would not sell to us. And this was a situation that many countries faced. The production was obviously limited compared to the demand, and the developed countries cornered the market. And then COVAX mechanism did not work for us as we have thought that it would. We are considered as a high middle income country, and therefore we were not the first ones to get the vaccine from COVAX. And to make matters more complicated, some of our neighbors were getting plenty of vaccines from China, which was exercising their vaccine diplomacy, as we saw throughout the world. And we have to recognize that the Chinese reacted very quickly to the pleas of the countries that are friendly to them, which is not the case of Guatemala, because as some of you may know, we have diplomatic relations with Taiwan, and we are very proud of it, and not with China. So we ended up contracting with Russia. And the production of the Sputnik vaccine was not at the level of their commitments, and they did not deliver what they had agreed to. It was a very frustrating because we had the money to purchase, but we were not able to. Which, by the way, Guatemala was not the only one in that situation. Yesterday, I had a conversation with an ambassador of an African country, and he told me that they had to pay $29 per doses, which is a very, very high price for a single shot of a single vaccine. So we were facing this terrible scenario with not just the health challenge, but you can imagine the political one related to it. And fortunately, the U.S. came to our rescue. They gave us the first 4.5 million vaccines. Then we started receiving some from COVAX, and also the Russians started to come through as well. Then the U.S. gave us an additional 4 million vaccines, and this was just recently. Last week we got 2 million on Saturday. I think it was the date. I think that per capita, we may be the country that have received the largest donation by the U.S., and we are really, really eternally grateful. The U.S. also gave us respirators and humanitarian assistance, and the solidarity has been incredible. So far, we have received either by donation or purchase around 16 million vaccines, which is not enough to vaccinate our population, which is about 16.5 million people. We have administered so far 10.5 million vaccine approximately, which is about a third of our population. So we still have a long way to go. But we also have some hesitancy from parts of our population to get vaccinated. So we have also that hurdle to overcome. But as we know, the pandemic is far from being over, and in Guatemala we have not yet gotten the Omicron variant, but it may get there, and I hope that we do not get up to the Omega variant. But in order to achieve that, we need international collaboration and coordination. No country can do it by itself. And let me use the example of the United States. And how important is vaccination in countries, particularly south of the border in the Western Hemisphere for the United States. Every month, there are about 200 through 250,000 people crossing the border, migrants coming to the United States. And what happens if they are not vaccinated? We can easily guess the consequences. That's why in my early engagement with the administration and with the U.S. Congress in talking about vaccines and donation of vaccines, I also emphasize the issue of national security for the U.S. But beyond that, there is need for dialogue and reaching an agreement at the highest level. And there is a great opportunity that we will have at the Summit of the Americas in June of next year. And I think that opportunity we have to seize. We have to promote that. And that's something that we should push forward. And I commend CSIS for having brought this issue to the forefront. And perhaps at the question and answer period, Dan, I can address a little bit more about some of the thoughts that I have on the Summit of the Americas and vaccines. Thank you.
I would welcome that very much. Ambassador, let me just give you another minute. I think it's very important for our listeners to understand that because Guatemala has been a reliable and faithful partner to Taiwan, and that's something, and has been a great partner to the United States, that mainland China has been using its vaccine as leverage in the Western Hemisphere. They used it to pressure the Dominican Republic and to pressure Brazil to open up their telecom system, saying, hey, you want our vaccine? That's fine. You will open up your telecom systems to Huawei, which is like opening up your telecom systems to Chinese intelligence, basically. They've gone to countries like Guatemala, I believe, Ambassador, and they've gone to Paraguay and said, you know, if you would just recognize us, this is sort of like almost like a biblical temptation, like being on like, all this will be yours, just like it was like the devil himself showed up and said, I will tempt you and say, if you recognize mainland China, I will solve your vaccine problem. Is that the case, Ambassador?
And you know, and to add,
is that correct?
Yes, you are, Dan. And to add to that, we just saw what happened in Nicaragua. Nicaragua just opened diplomatic relations with China, and what was the first thing that they did or they received were vaccines. A full load of a plane of with carrying the Chinese vaccines. We saw that with one of our neighbors that received the Chinese vaccines was sharing those vaccines with border municipalities in Honduras and also promoting that in Guatemala. So we see that, and you know, if I make another comment, and I think it's the participation of Taiwan in the WHO. Because we were one of the countries that promoted that participation, because you may remember the excellent results of how they managed the pandemic at the beginning. We, as different countries around the world, could have benefited more from the experience of Taiwan. So I think that's something that we should also look into.
Thank you. So I think it's been something that, so they have significantly been using their vaccines to the extent there's a vacuum, China will fill it. And China will take advantage. And this has been not in the Western Hemisphere. This has happened in several countries, including Guatemala.
Yes,
this has impacted your country. Thank you, Ambassador. Maria Boyce, thank you for being here. I thought it was very important to remind folks that vaccines and the delivery of vaccines just don't happen magically, that it requires the private sector, and that the private sector actually develops these vaccines, and then the private sector plays a critical role in providing the cold chain to deliver important vaccines. So I'm so pleased that UPS, which is a great partner on delivering vaccines, could be with us today. Thank you for being here, Maria.
Dan, thank you so much. And it's really an honor to be with all these speakers and be part of the panel. I think as I'm listening to everybody and your question about the region, maybe to put to your point, everybody has talked about the policies, the challenges, the concerns. I'm going to talk a little bit of the practical implementation, right? As a company, to your point, when the crisis, when we saw the situation, what was happening, UPS has over 20 years of experience working on healthcare, but delivering vaccines required a cold chain infrastructure, required working with governments. Not only is the movement of the vaccine, but also the distribution, right? And having all the different things to distribute. And I think in the region, I should say in advance, I'm a customs nerd and I'm a trade nerd, so I apologize in advance for that. But one of the challenges in the region in Latin America was that we were still dealing with many processes that required that required a lot of paper, a lot of not automation in terms of the processes, and the vaccines really brought to light the needs in the region of having a more effective movement of cargo in the region, specifically in the areas of, in this case on the vaccine, what were the processes that would be more efficient to help deliver faster the vaccines to the populations. And the other part, I think for us as a company too, that we have seen worldwide and in the region was that many of the countries had the vaccine distribution ready, but they were for vaccines for children. They were ready for the usual vaccines. And now you were talking about vaccines that were for all the population. Imagine you needed syringes or the delivery for vaccines for adults, and all of those elements that you needed to be able to deliver. Some countries did not have it ready. They had to train people on how to deliver this. And that's where I think for the region, it was a shock to the system in terms of how to make it work without going through the usual process of this delivery. From a UPS perspective, we saw in that respect in the region different challenges. For the first time in this specific area, the ministers of health had to work with customs agencies and coordinate. How do they coordinate that process? Many countries had best practices of organizing and having a key group that was working together and trying to make it the most effective. Other countries had miscommunication. I'll give an example. In Latin America, we were coming with a plane with important equipment for the vaccines. The federal government where we were going had give the green light. Yes, we're ready to receive you. They didn't talk to the city. And so the city authority did not allow our employees to make it to the airport to be able to take the materials out of the plane to be able to deliver to the hospitals. We had to return the plane because there was a time frame by the air authority in that country that said that you had a limited time to be and remain. All of that could have been solved, of course, by communication and coordination. And so I think that maybe for this first question, what we saw in Latin America was really that need of better coordination, automation, transparency, principles that the private sector has been talking about in the region to be able, the practical part of that delivery and be able to connect and reach out to all the countries. Last but not least, I want to share that this week we reached 1 billion doses that we have delivered worldwide in 110 countries. Yeah, I share it as I'm very proud of working with UPS because we have made certain to continue this piece, and our UPS Foundation that is helping, and we have donated the not only the vaccines, but the supply, the cold chain. I mention it because there's still a lot of work to do, and I was listening to Catherine and Elizabeth's statistics and the numbers with the ambassador. I think we also learn, because of the tragedy of the pandemic, we also learn that we can do certain things better, right? And by force, some best practices were implemented. And I think for the summit, for me, and for us as an industry, is I hope that the countries appreciate and learn what were those best practices and make the changes that they saw, that they implemented under an emergency situation, that now they can implement to have a better sense of how to move forward and manage the delivery of healthcare. So I'll stop there because I know we have more Q&A, but it's really, thank you for the opportunity.
Thank you, Maria. Thank you, because I think it's important we just remember that when I show up at the pharmacy, the vaccine doesn't just kind of magically appear, right? I mean,
exactly.
This doesn't just happen, right? And especially the mRNA ones require a special cold chain, right? There's a very special.
Yep.
So it just doesn't just magically appear. So there is magic, or feels like magic, but it's not magic. What you guys do is really make it look easy, but it's very complicated. So thank you, Maria. Bill, thanks for being here. You're an important voice on global health. You have been for a long time. You've done really important public service, and I think you've also been willing to buck orthodoxy where you thought it was necessary. You also know the region really, really well. Bill, I'm so glad you're here. I'd welcome some initial thoughts from you. Bill Steiger, please.
Thanks, Dan, and thanks for having me. I'll posit to you and the audience that the single most important thing that the United States could do for COVID, the response to COVID-19 in the Western Hemisphere, is to jumpstart the production of COVID vaccine on a regional basis with proven safe and effective private sector manufacturers. Now, I don't mean to say that every country needs its own manufacturing plant. We're not talking about state-owned airlines in the old days, the vanity projects that are money losers and are white elephant projects for employment and that are drains on government treasuries. I'm talking about a small network of private sector companies that can produce on the region up to the standards necessary that are set by stringent regulatory authorities. I've been encouraged to see that the administration has made some feints in this direction or some nods in this direction. The announcement in November of a bunch of money to improve manufacturing capacity seemed to be focused mostly on domestic capacity, but there was some language about doing this overseas, but no details. The tools are there in the US government to do this work. The US International Development Finance Corporation, a year ago or more in 2020, launched something called the Health and Prosperity Initiative, which is a good start. It makes financing available for these kinds of ventures, but it is lacking one important thing, and that is a strategic plan. The DFC's window of financing is really dependent upon the goodwill and the interest of manufacturers and other investors to apply for money. What the administration needs is a very specific strategic plan to build this manufacturing capacity in the region in friendly nations that are stable, well-governed, democratic, and are going to be working with their private sector, investors and manufacturers, in ways that are insulated from changes in political administration or in ideology. It's crucial that we're talking about qualified companies that can meet those standards to produce safe and effective vaccines. We're not talking about, as I say, fly-by-night operations or temporary ones. These have to be facilities that can be profitable over the longer term, because I think we all agree that probably COVID vaccination is with us for a long time, as influenza vaccination has become standard. We're going to get into that world where we're each going to get either 2 shots every year for the flu and COVID, or we're going to get a combined one as science moves further along. In doing so, there are several things that are necessary, and I'll talk about a couple of specific challenges that Drs. Fox and Bliss didn't talk about yet, relevant to vaccines, in just a minute. We tried to do this very idea in the Bush administration, Dan, by the way, and it didn't really work. It was for pandemic influenza vaccination. Secretary Leavitt at the time put money aside for us to try and invest in technical assistance with various manufacturers around the world to begin to produce vaccine against the next influenza pandemic. Different technology, different disease, I know, but the intent was the same. HHS, unfortunately, the Biomedical Advanced Research and Development Agency, screwed it up because it gave the funding to the World Health Organization to do this work. While the WHO has a role, while PAHO has a role, we can't rely on international institutions to do this. We have to have the participation of the private sector up front and the US flag flying on this initiative. What the administration needs to do is to go out and recruit manufacturers and match them with financing through the DFC and with technical assistance in a couple of areas. I'm very encouraged by what PAHO has done, the Pan American Health Organization, in its recently announced platform for the advancement of manufacturing of COVID-19 vaccines and other health technologies. Applications are coming in and supposedly being reviewed. That's great. That'll give a list perhaps for the administration to start with, but I would not outsource this effort to multilateral institutions. And I should say, because you will appreciate this comment too, Dan, I would not support anything that veers into the lane of compulsory licenses or mandatory technology transfer. This has to be voluntary out-licensing, as several of the manufacturers have already discussed, and it has to be done in a way that is ultimately profitable. So a couple of challenges that have to be part of this package that folks haven't mentioned yet. One is that vaccine manufacturing itself is not enough. We also have to work on the manufacturing of resins and other vaccine components without which the finished product cannot be made. Second, and probably bigger, is quality control and quality assurance. We already have the example in the United States of Emergent Biosolutions under a contract with HHS, just 25 miles from FDA headquarters, that failed all of its tests, lost its contract. Vaccine manufacturing is hard to do. It's harder to make a vaccine than it is to make a drug in most cases. And the quality assurance process is a very difficult one, and it has to be maintained with great vigilance. So an essential part of any administration strategy and package has to be very detailed, very specific technical assistance around vaccine manufacturing with the participation of the Food and Drug Administration, which will resist it. FDA doesn't want to get into this business, but the FDA has to be part of any package that is going to do what we hope it will do. And that part of that has to be boosting regulatory capacity on the national level and on the regional level. It's not enough just to, even on a voluntary basis, transfer technology. So my bottom line to you, Dan, is a network of well-regulated private sector producers funded in friendly, stable countries with the participation of the United States and the private sector is one of the major solutions for this pandemic and the best thing the administration could do in the Americas.
That was awesome. That was like eating like a candy cane listening to you, Bill. That was just wonderful. Thank you. We need to have you more often at CSIS. That was great. I 100% agree with you. If I'm an elected official, I'm going to pick Pennsylvania over Paraguay. No offense to Paraguay, every day of the week. It's very difficult to break the iron laws of vaccine nationalism. So this issue of creating additional manufacturing capacity at levels of quality on a voluntary basis, and that was my deep thought in getting ready for my Senate testimony 3 weeks ago when I talked to you, and I talked to the Ambassador Quinones, and I talked to Elizabeth Fox to get smart about this. Is my deepest thought coming away from this is that we need to pick some countries. I could name some, but let's use Singapore as sort of the model, a small country with strong rule of law, with a strong workforce that could within 25 minutes kind of meet its own needs for vaccines. And then everything else is for export, because until a country meets its own domestic needs, we're going to have the kinds of problems that Ambassador Quinones was describing earlier. So we need to have, in essence, additional places. I could think of some countries in the Western Hemisphere, small countries, democratic, with great rule of law, with a very high quality workforce, where within 20 minutes or 2 hours, you could kind of answer the mail on delivering vaccines for the country. And then everything after that, UPS could export and fly all over the rest of the hemisphere, right? That's what you're getting at, right, Bill? That's what we're talking about.
That's right, because as generous as we have been as a country in donating vaccines manufactured here, which is a great thing, that's not a sustainable model. And
100%.
We have to be encouraging investment in the biomedical sciences anyway in the Americas. This is about protecting us as much as it is protecting the rest of the region. It's our national interest to do this, and it's our national economic interest to do this, as well as it's in the interest of the countries that would be part of this, because this is creating jobs and creating an inflow of net foreign investment and technology that will benefit their biomedical sectors over the long term, not just for COVID.
So, I mean, some of the previous interventions talked about that there's been high levels of vaccinations. There's, I would argue, largely a culture of vaccination in the Western Hemisphere, with unfortunately a few bad exceptions because of either sort of vaccine hesitancy or disinformation. So the demand signal's there. So we can get the demand, we can deliver it, but we need to create this. I 100% agree with you. It seems to me that would be something, a potential thing we could do at the Summit of the Americas. Is one of these issues could be this that you're putting on the table, Bill, right?
Correct.
Okay. All right. So I'm going to come back to everybody. So now this has been great. I'm really happy I convened this group. Every one of you made really smart and interesting comments. This is great. So I want each of you to tell me, okay, what would you like to see in addition to what Bill Steiger's put on the table? Think of one or two things. And I think a little bit, Maria, you sort of alluded to some of this as well. What are one or two things you'd like to see us come together on around the Summit of the Americas? Let me start with you, Ambassador Quinones, and then I'm going to go to Elizabeth Fox. I'm going to go to then Catherine Bliss, and then I'll go to Maria. Ambassador.
Thank you. Thank you. I think that one has to understand the Summit of the Americas process, and it's a process, which, by the way, is very dear to me, because my last incarnation at the OAS was the head of the Summit office. I was the secretary for the Summit of the Americas, and I participated and had been engaged with all but one of the summits. So the United States, as the host, can propose the topic, the theme for that would guide the discussion. That would have an impact on the success of the summit. Obviously, the definition of success for a summit and how to measure it is complicated, especially because we may see a different hemispheric scenario with some of the results of the elections that we have been having. So perhaps having a topic that it's that can be unifying among the countries, and not
this is a potentially unifying topic.
Exactly. Yes.
Right?
Whereas if you go for issues on other issues that are complicated, you may end up having a very complicated summit. But there is one resource or tool within the summit process that is seldomly mentioned or engaged. And that is the Joint Summit Working Group, which is a group comprised of international organizations. Most, if not all of them, engage with helping countries address COVID challenges. The OAS is the one that coordinates, but there you have the IDV, you have the World Bank, you have PAHO, you have ECLAC, you have UNDP, and others. There are 12 in total. And the objective is to increase coordination among these international institutions that are active in the region, and also to set up mechanisms that would help in the preparation of the summit, but also in the coordination on the follow-up of the commitments coming out of the summit. So perhaps then a further conversation in a couple of months could be with these institutions to see how they can plan in participating in the summit. And there is also civil society engagement and also private sector engagement. And that's where some of the ideas that Bill put forward, which are great, can be discussed. But also within the summit itself, because he talked about regulatory capacity in the countries, and perhaps the institutions that I just mentioned can help the countries in achieve or in getting to have that regulatory capacity, so to absorb that. One final point, and I just want to stress what Bill mentioned in terms of the importance of creating manufacturing capacity in the countries. It's of national security to the United States. Remember what happened with India. India had a big problem with COVID, so they kept all the production or most of the production of vaccines, and that created a hassle throughout the world. So if we have that capacity in the region, that would address that challenge. So I'm grateful and thankful that Bill brought up that point, which I think should be further considered. Thank you.
I love this. Thank you very much. Okay, Elizabeth, could I turn to you, please, and then Catherine?
Sure. Dan, I'd go right at the other direction on the demand side. Bill's talked about supply, but looking at demand in terms of what lessons can we share across these last mile delivery systems, which are looking at the community health level, looking at really vulnerable communities and getting vaccine to them. And I think this is where Latin America and Caribbean have a lot to teach each other and a lot to teach America in this. I think some of the issues of who do you believe, where do you trust, who really makes you change your mind. So it's putting those collective brains together that have been working at the really end of the supply chain to get vaccines into arms and to get people to show up and trust their health systems.
Elizabeth, let me just push a little bit further. I am not super up for like sitting in my basement again for 18 months. Again. I don't want to do this again. Like, I mean, I'm happy to do this on Zoom with you guys, you know, or on Microsoft Teams with you guys once in a while, but like, I'd like to like go back to like normal again. I don't know if we're gonna get back to normal for a while, but one of the things I think my friend and mentor, Andrew Natsios, has called for much stronger strengthening of early warning systems for pandemics, similar to what at AID, there's something called FuseNet, the Famine Early Warning System Network. So we need something like a FuseNet for pandemics. Now, I know that I'm sure PAHO does some of this. I know the WHO does some of this, but it seems to me, could you just comment a little bit about if you had the ability to make changes in early warning systems, what would you, how do we think about that? Because this is also a collective action issue.
Absolutely.
Might be something you talk about at the summit, right?
Yeah, absolutely. And it's the whole question of pandemic surveillance. It's how do you get people to say when they're sick so that we get cases identified, which also ties into trust in institutions. You need the labs, of course, to do the test and run the sequencing on the virus. But if people hide the sick people, and if they don't come in, there is no real surveillance. And so there is no real either preparedness or ability to get the vaccines in the right place.
But if I Google, I'm feeling sick today, or I've got a headache, even though I officially report it, can't we use data like Google data?
Sure, we can use the technology. We can totally use the technology, but you've got to want to use it. You've got to trust that someone will use the information, that someone will not come and put you in jail if you're sick.
Okay, right. That would be a bad, exactly. Catherine, let me turn to you. What's a specific thing in the context of this current pandemic or future pandemics you'd like to see discussed at the summit? And I'll turn to you, Maria.
Well, building on some of what Elizabeth has said, I mean, I think it could be a very good chance to assess the root causes of vaccine hesitancy in the region, including the lack of trust, and really work to address the issues of vaccine confidence. One idea would be to work collaboratively with social media companies to address the problem of misinformation, that is false information that about vaccines, and replace it with credible, compelling public health information. Maybe more of a challenge than one might think, but to tweak the algorithms that favor extreme content, and really continue to work as has been done here and elsewhere, but to continue to work throughout the region on the issue of misinformation. Another issue would be to collaborate to address the problem of disinformation, the deliberate use of false information to raise questions and doubts about, either a nation's vaccine or, reasons for donating vaccines or the like. And so this could include the development and support for kind of a hub, an information hub that tracks myths and disinformation across the different countries, across the different languages, and the networks that share information, and really bring together the health community, the cybersecurity community, and communications, along with national security, to develop tailored messages, both to, assess and understand the different circulation of messaging, but to develop tailored messages that can bolster confidence in COVID-19 vaccines, therapies, and other tools.
Yeah, that's interesting. I mean, I'm just thinking about in the United States, I've been a little bit dismayed by some of the, if I could kind of play armchair quarterback on how some of the public messaging on the PSAs, like I got my 2 shots, I got boosted and I got it right away. But it seems to me there's sort of several sub-communities of folks who are vaccine hesitant in the United States. I'm not going to list them all here, but it seems to me we could have done a much better job of being much more targeted and getting credible messengers for each of those vaccine hesitant communities. I know a lot of attention goes to sort of a certain subsegment of conservatives in the United States, but that's not the totality of the vaccine hesitant. There's several other sub-communities. And so I would have found conservative Catholic bishops, conservative evangelical ministers. I'd have found conservative political leaders and show them each getting vaccines and interview them to talk about it, as opposed to, I mean, some of the public messaging was sort of I'm not sure they picked the right messengers for some of that here domestically. It was sort of a tin-ear sort of a thing. So I do think that's a thing. And I also think, Catherine, one of the things I was surprised as I got ready for this testimony I did that Bill and Elizabeth and Ambassador Quinones helped me with was, some places, there's some Caribbean nations where there's really high, we have it in this country, absolutely, and in some other places, but there's some shocking, I think Jamaica has 25% vaccination rate. And I think it's not because of a lack of vaccines, it's because of a high degree of vaccine hesitancy. So I think this issue is a hemispheric problem and something we need to think about. But I also think we need to think about, like, we need to find credible messengers for just like in politics, find micro-targeting. We need to micro-target messaging to different communities who are hesitant for different reasons. So Maria, let me turn to you. If you were thinking about things to think about for the Summit of the Americas in the context of vaccines, pandemic preparedness, or for the next one of these, what would be some of the things you'd want to be on the table at the summit?
I think there's 3 things that I would like to suggest to be on the table. Dan, first, I do want to say into the conversation of the group that although COVAX is an essential structure to help with the vaccine delivery, is insufficient to be able to address the needs of the COVID vaccine response. And we have seen that in the region, that it's a big challenge. And I think we have to make a strong case that the United States has to play a larger role and more decisive role in leading vaccine distribution around the world and in the region. And private distribution and private sector, this is the second one. Governments should really discuss how the private sector can help be partners on this, and the private sector that has the cold chain, the distribution, the understanding, and not has, I mean, we UPS, we do it, that's part of our business. There are other companies, but it has to be a true private public partnership. And at the summit has to be this discussion on this piece, because we help monitor cross-border, at the border delivery, and when it is being put in, or I don't know the correct term, injected or put in the arms of the individuals. And last but not least, at the summit is really come across as governments, what are the regulations that need to be updated? What were the lessons learned from this distribution that need to be updated in the regulatory process, customs process, health processes? Because we have challenges facing, right? We have vaccines that are coming to, that they're going to be, what is the running out, expiring, that's the word in English, that they're expiring. We have changes that are coming. And so we need to have the countries, the leaders of the countries need to have, in the Summit of the Americas, have to discuss what is that regulatory update and best practices that they need to implement. If I may, then on last thing, all of these will help with transparency, because before COVID started, the region was facing a lot of challenges that we face everywhere about communications, transparency, a lot of social questions, right? And having a clear policy with that builds trust and has a clear understanding of how it is going to work will help the region in that economic recovery in this moment.
Well, this has been like Christmas has come early for me. I'm so happy I got all five of you on this. You guys are all so smart, and these have been really interesting and different interventions. I want to give you each 30 seconds or a minute to think about what's a message you want to leave about over the next, what do you want to see happen in addition to the summit? What needs to happen over the next 12 to 18 months? Or you could think about, what are you optimistic about as it compares to, I'm hoping you got something happy to say, because this has just been truckloads of lemons, and we've been trying to make juicing it up the lemons and turning it into lemonade at this horrible, but so I've been drinking a lot of lemonade. So think about, what are you optimistic about? What needs to happen? So in addition to the summit, are there things that you're seeing over the horizon? My sense is, from listening to this conversation, is we're not going to be short. I want to believe by April, which is not that far away, we're going to be awash in vaccines in the Western Hemisphere. I think that's a true statement. So if that's the case, what does it mean? And again, I just don't want to sit in my basement again for 18 months. Like, I'm not available for that. And I suspect all of you aren't available to sit in your basements for 18 months either. So I'd like to make sure that this is a once in a lifetime experience for all of us, and that we tell our grandchildren about it and they say, "Oh, isn't that nice? We solve for it with all the things that we've been talking about." So let me start with you, Elizabeth, in terms of just a parting thought or something you're optimistic about, or what needs to happen. I'll turn it over to you, please.
Okay, I'm optimistic. Here's your Christmas present. I'm optimistic about the creativity and resilience of communities in Latin America, and their ability, despite everything, when supply is there and the supply chain works, like Maria says, to actually get those vaccines in people's arms. And they're doing it all kinds of different ways. The creativity is amazing. But I think if we get down to that local level in the health system, something's working. And we've got to find more of it and support it.
Great. Bill Steiger?
Dan, I'm optimistic about innovation. I think what this pandemic has shown is how the American private sector can really can solve problems very, very quickly when we put our collective minds to it. And I've talked a lot about bilateral assistance in my comments. I'll say one final thing about multilateral, because I think there is a real place for that. But if you want an off-the-wall idea about a multilateral component of a strategy, it's to amend the 1947 Inter-American Treaty of Reciprocal Assistance, or the Rio Pact, to account for pandemic events, not just armed aggression.
I love it. And we should raise that at the Summit of the Americas. I love it. Yes, yes, yes. Maria, you're next.
Oh, I'm thinking on the positive or Christmas gift. I am I am hopeful that the region will learn and grow from this experience to have a more transparent private-public partnership to find solutions to problems. I have seen it. I see the work that we're doing with governments. I think the lessons learned that I have seen the love of country for their countries, for their co citizens in different countries, that I think that gives me the hope that they will look forward and find a solution. And I see the hope for the United States to become again a leader in the region, that they have lost a lot of that leadership. I know I'm being too optimistic. No,
yeah, it's hard to be optimistic in all this. Like I said, it's like a truck full of lemons were dumped at our doorsteps. We had to just break out the juicers and make all like gallons and truck gallons of lemonade, for the last
as a U.S. company, we're doing it, and other companies are also doing it. So we hope that we can make it happen.
Well, I look, a billion vaccines delivered. I mean, that's amazing. Like I said, that doesn't magically happen. Like, we needed Operation Warp Speed. We needed American and global private sector innovation to develop these things. And then we actually have to deliver them in cold chains. And that doesn't happen, like I said, magically. Yeah. So it requires a partnership, and it requires the private sector. So I think that's right. And this is great. Good. Catherine Bliss, please.
Like the countries of the region have a long history of working together on health issues, going back to the late 19th century, early 20th century. There's a long history of Pan-American solidarity and working together on health research, development of products, and delivery of services. And, we know the people of this region are highly connected politically, economically, socially, and culturally. And so, I think now really is an opportune moment, and the summit is perhaps a good chance to really, push this forward for government, the private sector, and civil society to come together to develop and push forward plans, not only for, really ensuring the equitable and full distribution of vaccines and all the COVID tools to people of the region, but also really coming together to plan better and prepare for pandemics of the future.
I 100% agree. PAHO predated the WHO. Mm-hmm. And I'm going to make a little bit of a slight editorial that some of the organizational challenges we find with some of the issues of the WHO, where the regional heads of each of the regions of the WHO, is because I think the United States and other shareholders said, we've got this great thing going called PAHO. We don't want to screw it up. And so we sort of kind of jerry-rigged, this is Dan's version of it, we sort of jerry-rigged the org chart at WHO around PAHO. And then we said, we'll just replicate PAHO-like organizations in each of the regions. That has created some challenges, I would argue, in terms of the organizational structure of WHO, because in essence, the regional head, so the regional head of PAHO is an employee technically of WHO, but so there's some funniness. And so I think that's something I'd love to see addressed, but I'm not sure we can address that at the summit, but I think it's something to think about. But I do agree with you that there's been regional solidarity. I think PAHO, a little bit to Ambassador Quinonez's point, Catherine, thinking about hemispheric wide health as it was that's why they designed PAHO. So thank you very much, Catherine. I really appreciate it. Ambassador Quinonez, I'll give you the last word.
Thank you very much, Dan. And I think that we have a great opportunity in front of us with the Summit of the Americas. And I hope that we can take advantage of it and really address some of the issues that were brought up here. We have to remember that the Summit of the Americas is not an isolated event. It's a process that has a history and has a future, and that in that process there are many actors participating, and we have civil society, we have private sector, and obviously the government. So the things that we're discussing here can perfectly fit into the process of the Summit of the Americas. Issues to discuss on regulatory capacity, issues on creating an information hub for the Americas. That can be an outcome for the summit. Early warning systems can be put in place if so decided, and there is a political will to do it. So the summit is a precious mechanism, a precious process that if there is that political will, and that has to be pushed for, can achieve great results, and I hope that is the case.
You know what? Thanks, everybody. I'm so grateful. This has been so interesting, and I'm just so pleased to have had all of you participate today. You bring so much expertise to this and brought some really great perspectives. I really appreciate you all taking the time. Thank you all. Thanks for joining us, and I hope to see you all in person very soon. Good. Let's do this again in person next time.
If not in your
Sounds
basement.
like a date, yes. Thank you.
Thank you.